Hey everyone, this is Daniela from the Obstacle Doc, and today we're going to be talking about the core and the pelvic floor and how they work together and what they all do. So, to talk about the core, a lot of people will say that when they're activating their core, they're just kind of pointing to their abdominals. So, I want to flesh out what that really all entails, why it's really important, especially for introducing any pelvic floor work, activity, etc. So, our core, when we're looking at it from a muscular standpoint, we'll really try to appreciate the entire center of our body. So it's basically everything except our limbs. So we're looking from the bottom of the glutes, right, to basically the top of our shoulders. So from the front to back, if you're imagining kind of like a soda can or a middle if someone's standing sideways, we have our abdominal, so all four layers at the front. In the back, we have our paraspinal, so you have deep muscles running alongside the spine all the way from the tailbone to the top of the head. Your shoulder girdle or your shoulder musculature is also going to be a factor, especially if you are in a load-bearing position, like a push-up, like a plank. And then from the center here at the top, you have your diaphragm. It is a breathing muscle. It also helps maintain pressure. And then from the bottom, you're going to have the pelvic floor, which we're going to dive into in just a second, as well as the glutes around the back. So all of those muscle groups are working together to stabilize your center, whether it's in load bearing, not load bearing, or if it's just managing pressure. So to dive into the pelvic floor specifically, we're going to talk about its main functions and then a little bit about the anatomy just to get a better understanding. So your pelvic floor is the space and the muscles between your hip bones. So it runs front to back, side to side, kind of like a little hammock. It has three layers. So there's an external layer, that's your layer one. There's a little layer in the middle that just has a couple of friends in there. And then your layer three is your deepest layer. It has the most muscles, as you can kind of see. So our first main function is to support the organs that sit on top of it, which is everything, all of your organs, especially if there's a little human being made inside the uterus. That provides a lot of support. Your second is going to be for sexual function, so whether that's pleasure or function, whichever you are using it for. Your third is going to be for bowel and bladder control, your sphincteric control. So this is where it gets really important. Our pelvic floor muscles, when they contract, they close down the sphincters. So you have three sphincters if you have a vaginal canal. You have two sphincters if you do not. Regardless, those sphincters close when pelvic floor muscles contract. And when they lengthen or relax, that is when the sphincters open. Very important. We're going to come back to that. Our fourth function, main function, is our lymphatic control. So lymph nodes are in the body. There's big ducts that are collect kind of here in the armpits and in the inguinal area. Those are what your physician might check if they think you might be getting sick, because sometimes they get swollen. So usually normal in most people, not really swollen, nothing to really worry about, but muscles, when they contract, they do move lymph fluid. So that is part of its job as well. And then the fifth function, which is really where we kind of get into the nitty gritty, is stability. So this is part of, like we said, the core that helps control what the pelvis is doing, if it's tipping, tilting, going forward, or rotating from side to side unnecessarily. When we think about the pelvic floor's job in the core, it's really the biggest pressure component, and where we'll start to see some pressure breakdown. So for people who have any kind of stress incontinence, right, which is when we're losing control of the bowel or bladder, when we're jumping, running, laughing, coughing, sneezing, that's usually a question of where are we losing control from and what's the breaking point. So when we're talking about how to assess the pelvic floor internal assessment is very different from a internal exam that you're going to see from an OBGYN. It is a single digit glove and some lubricant. There are no stirrups. There is no speculum. It is very, very minimally invasive compared to maybe what you experience in those offices. And what we are looking for is the actual muscle tension, the feel of the muscle itself, as well as the control, the endurance, and the power from all three layers. So in our office, what we do is we check left to right in each layer, layer one, layer two, layer three. And what we're looking for is, are you able to contract the pelvic floor? Are you able to keep that contraction? So we're looking at the endurance. And then also, can you release the contraction or the coordination? All three of those are super important so that we can appreciate how your symptoms are presenting and what we can do to better improve them.